The most compassionate thing a doctor can do is make a diagnosis.
Yes. Yeah. Well, that's the hardest thing to do. And
Right.
but as you know too, that takes time and thinking about the case. It just I mean, the easy ones are the easy ones. The hard ones are the
No,
hard ones.
but also the flip side is it's okay to say, I don't know what you have,
Yes.
but I
That's
think what you have is not dangerous. And then it behooves you to say, here's why I think it's not dangerous. And here's what we do if things change. And I think with that young man in the New York Times article, it was his second visit to the ER in 24 hours. He had abnormal vital signs. He was coughing up phlegm and having trouble breathing, and he was getting worse. And so his blood count, I think his hemoglobin was low. They didn't publish exactly what what the lab values were, but they said had an abnormally low hemoglobin for a young man. And so there were warning signs. And you need to be able to make sure that the people you say, oh, you just have a virus, have no warning signs, that you've really checked and made sure that there's nothing dangerous going on here. And
you
then
know
say, I don't know what's wrong with you, but if you're not all better, like we said, cartwheeling and jumping jacking in the morning, then I want to see you back.
Yeah, I think we started to also talk about this one a little bit too. I think it was the Columbia student, right? And his
Right.
parents were out of the country. I forgot
Right.
because they have some kind of job not in Europe.
Right.
And his girlfriend was the one who took him, and nothing against her. I mean, she brought him in. She says, "You don't look well." And then she said something that was so strange. Well, I shouldn't say strange. It was like she said he just didn't advocate enough for himself. And I think that's a lot to put on the patient.